I'd like to welcome all of you as we continue our Business Power Hour series. Thank you all for taking time to join us today as we talk about some very important matters. Let me begin before we get to our speakers by once again thanking our sponsors of our Business Power Hour, First National Bank of Central Texas as our presenting sponsor and Spectrum Reach as our gold sponsor. We certainly appreciate these companies and their continued support of your Chamber of Commerce. So today we're very fortunate to have with us a couple of individuals from the U.S. Chamber of Commerce, and we also have with us a couple of individuals from our backyard. And we're going to have a conversation about COVID-19 in the workplace, both from the standpoint of being an employer, as well as what employees can do to tend to the issue and hopefully not bring COVID-19 in the workplace and to stay healthy as well. And then we have a couple of individuals, as I said, from our backyard who are going to be able to provide some value in terms of what their companies are doing related to COVID-19 in the workplace. So let me begin by introducing Katie Mahoney. Katie Mahoney is Vice President of Public Health for the United States Chamber of Commerce. She's responsible for developing, advocating, and publicizing the Chamber's policy on health and works with Congress, the administration, and regulatory agencies to promote the organization's health policy. Katie received her undergraduate degree from Vanderbilt University and earned a law degree and master's degree in health administration from Tulane University's Schools of Law and Public Health and Tropical Medicine. And Katie, the floor is yours. Thank you for being with us.
Great, thank you so much. Hello, everyone. It's a pleasure to talk with you today. I thought I would cover a few different things, three in fact. One, talk about some of the priorities that we have long been pushing for that were included in the CARES Act that was passed, that passed Congress at the end of March. Two, talk a little bit about provider funding that is being allocated by the Department of HHS. Three, to talk a little bit about opportunities for employers to make sure that their employees and members of their community are aware of different ways to access healthcare coverage during these difficult times. And then fourth, just touch on very high level the next stimulus package, which folks here in Washington are referring to as phase 3.5. It's the fourth package, but for various political reasons, they're talking about it as 3.5 instead of phase 4. First off, there were three big things that we have long pushed for that were included in the CARES Act that go beyond COVID-19, but may have been possible, frankly, because of the effort to get assistance out to help businesses in this time of disaster. Number one, there were some significant changes to telehealth and the ability for carriers to provide and providers to offer telehealth services, one of which includes something that we've long been pushing for, which is the ability for HSA eligible, so health savings account eligible, high deductible plans to be able to cover on a pre-deductible basis telehealth services and other remote until December of 2021. That's, I think, in recognition of the need for social distancing and the importance of maintaining the ability for individuals to still be able to see their providers at this unusual time. I think there are hopes that that change will be made permanent, but it's certainly an important first step. Secondly, in the CARES Act, there was a repeal of a limitation that was enacted as part of the Affordable Care Act, and that is the requirement in the ACA that in order to use tax-preferred funds from an HSA, FSA, or HRA to purchase over-the-counter items, you needed to have a prescription for those items. And that was something that we opposed in the Affordable Care Act and have been pushing for over 10 years to get repealed. And that restriction and limitation has been repealed as part of the CARES Act. Third, another overarching effort that we've been involved in that was included in the CARES Act that go beyond the current crisis is the streamlining or the homogenizing of the privacy rules under 42 CFR Part 2, which deals with substance use disorder provisions, and HIPAA privacy. And the change in the CARES Act allows for a provider to, after a provider receives consent once by that patient, they can include their history of substance, the patient's history of substance use disorder in the electronic medical record. So in the past, if I, for example, had a history of substance use disorder and I wanted my substance use disorder provider to share that information with my OBGYN or with my dentist, I had to give consent every single time I wanted that history shared with another provider. Now I can make one blanket consent and that can be shared across the board. Apologies. So those were the three kind of overarching things that we had been working on for some time that got wrapped up into the phase 3 CARES, which is, I think, a positive few developments. Secondly, I wanted to talk a little bit about the provider funding because I think it's been a bit opaque. Many folks are aware that $100 billion was allocated to HHS to give to providers that are dealing with the COVID-19 crisis. Once that was allocated, it really was very unclear how and when the money would get distributed. On April 10th, the first tranche, as it's been referred to, of $30 billion was allocated to providers on the following basis. $30 billion was allocated based on providers' Medicare fee-for-service claims in 2019. And so as of April 10th, funds were electronically transferred into providers' accounts. And those amounts were based on how many Medicare fee-for-service claims they saw back in 2019. Depending on who you talk to, that may have been the appropriate calculation or it may not have been. We've heard from hospitals that only 10 billion of the 30 billion ended up in hospital accounts because of the Medicare fee-for-service metric, which did in many instances benefit ambulatory surgery centers and other providers. There were 2 attestations that providers receiving those funds had to agree to. Number one, they couldn't balance bill any patients for COVID-19 related claims. And number 2, they had to attest that they had seen at least one or one potential COVID patient. So it will be interesting to see if there's any sort of enforcement on the back end as to whether a provider says, oh, wait a minute, I got money, but I actually didn't see a COVID-19 patient and I shouldn't have gotten money. I think a lot of skepticism as to whether or not that will be enforced and whether recipients will be forthcoming about that piece. So we've heard some concerns about that first tranche of money and how it was allocated. And the hope is that the next tranche will be allocated in a more targeted way to make sure that those recipients that receive the money are those that are suffering from lost revenue due to COVID-19. The third item that I wanted to talk with you about was insurance opportunities. We are putting together a guide at the U.S. Chamber that we hope to share with our chambers of commerce around the country and our other members that detail for chambers and employers the different coverage options that are available to employees at this time. So as employees are furloughed, as their hours are reduced, as their income levels are reduced, if they are fired, there are a number of different opportunities for those individuals to access healthcare coverage. Number one, COBRA, which is an expensive option, but is something that we want to make sure individuals are aware of. Number two, if they lose coverage through their employer, they may be eligible to sign up through their spouse's employer-sponsored plan. Number three, and this has been something that's been a little bit conflated with a recent announcement from the president, but there are special enrollment periods available to anyone that has a qualifying life event. So if you lose healthcare coverage through your employer, you may qualify qualify for these special enrollment periods in the individual market and potentially even a premium tax credit to enroll in coverage in the individual market. One of the things that's been a little bit misreported and misunderstood has been there was an effort to encourage the current administration to create a new open enrollment period because of the pandemic, and to say, with this pandemic, we're going to allow for anyone who decided not to get coverage through the exchange to have a new bite at the apple. The president said he was not going to create a new open enrollment period, meaning if anyone decided not to elect coverage back during the fall, they could now, at this new time, have a new opportunity for a new open enrollment period. That's been a little bit misconstrued and conflated with the existing special enrollment period, which does exist for people that lose their employer-sponsored coverage and has always existed under the Affordable Care Act. So that is still an option as well. Finally, the new deal that is coming together, which the Senate is expected to convene at 4 o'clock today to vote on, and the House is expected to pass on Thursday, includes $30 billion renewed funding for the PPP program, the Payment Protection Program, $75 billion additional money for hospitals, $25 billion for testing, and $60 billion for economic disaster assistance. I know that there will probably be a fifth phase or a fourth phase, depending on whether you call this 3.5 or 4, but that's sort of where things stand at the moment, and I'd be happy to take questions.
Katie, thank you for that presentation. Let me ask my board chairman, Rick, have you received any questions?
We have not had any questions posted, but that's a great point. Our participants need to know that there is a live Q&A. So down at the bottom of your screen, you can see the Q&A button. So if you have a question you'd like to give Katie, a really hard one, hopefully, now would be the time to put it out there. I guess, while we're waiting for that, Katie, do you see, future phases of stimulus coming out of this that, you hear a lot of times about infrastructure projects or, other things that the government would do in a time like this? I mean, what are some of the future phases that you could see coming out?
One of the things we're thinking about and trying to plan for is a phased return to work, and what is necessary for business to consider doing that, and how and where would we do that based on local health reports and status. So there's been a lot of discussion, and I know my colleague Matt Webb will probably touch on some of the liability protections that we're very concerned about. I think there are a lot of questions about how can an employer test their employees, what's appropriate for a business to do in terms of ensuring the safety of their workforce. How can businesses protect those that may have that may be more vulnerable to this? So are there ways to make accommodations for those that may have chronic conditions, that may be in the older range, that may have other qualifiers that make them more vulnerable? And how do we allow and enable businesses to protect those workers without getting without repercussions and allegations of discrimination? Because many of those elements that make someone vulnerable are also protected elements. So whether it's age, whether it's disability, health status, how can you make sure that you're protecting people but not opening yourself up to lawsuits? I think a lot of things that we've been focused on at the Chamber have been around childcare. What happens if a business opens up and the schools are not open or the camps? How do we facilitate the return to work in those instances? So, I think that number one, the easy answer is money. I think we expect that there will be a need for more money. I think that the package that is coming up for a vote this week is a $475 billion package. I think the expectation is that more money will be needed, and probably some other guardrails that give some comfort to businesses, whether it's through liability protections or elsewhere.
And Katie, I think it's important for us to share with the folks who are participating today that we're going to have Matt Webb on in just a few minutes from the Chamber's Institute for Legal Reform, and he's going to be able to address to some degree, the legal ramifications. So that's coming up soon, folks, and I'd ask you to be patient. We do have another question, Katie. It says, one of our challenges in opening and maintaining an environmentally safe workplace is access to proper cleaning products, with priority going, as it should be, to first responders. Do you have any thoughts on when the supply chain might catch up with demand?
I don't. And I did look at the chat function to see, I saw the little 4 number there. I don't know when the supply chain will catch up. I think it does depend on the locality. Even here in the DC area, where we're, whether you're DC, Maryland, or Virginia, there's disparity even within a 10-mile radius between different stores. So I'm not sure. I wish I could answer that question. I think there was a question, it looked like, about testing,
Right.
whether or not you can screen employees. I know that there are a lot of attorneys that don't just play one on TV like me, but that live it and breathe it and practice in firms on legal issues and legal questions like this. I think one of the recommendations I've heard from a former legal colleague or former attorney at a practice is that you can maybe ask a slew of questions. So going back to the vulnerability, you can say, if you can say yes to any of these things, please contact HR and you may find some accommodations. And you say, are you older? Do you have an underlying chronic health condition? Are you, and list a slew of things, and they don't have to say which one it is. So they're not identifying or disclosing anything that's protected, but they are saying one of these categories applies to me and I'm going to need some additional accommodations.
Thank you.
Katie, what about actually taking temperatures of employees when they come to work? I mean, is that considered invasive?
I think that we've gotten that question before. I think, to me, the fundamental question before you even get to that is, what is the science telling us? And is the science that a temperature check is going to be sufficient? If you're checking for antibodies, do we know what level of antibodies are appropriate to deem someone safe to return? Is it a different level depending on your vulnerability? Do older people need a higher level of antibodies? I think that the science piece is still lagging a bit in terms of what's appropriate and what will really identify or be an indicator of safety. So I guess I kind of go back to that question, which is, we've heard such conflicting information about, in the beginning, masks aren't helpful, but now everybody needs to wear a mask, at least in Maryland, if you go into a grocery store. And so, it seems as though the science is sort of very fluid in this space right now. And until we have some real concrete data points as to what indicates that someone may be safe and less vulnerable to be in a working environment, I don't know that the question about invasiveness is really the one we should be asking.
Gotcha.
Well, Katie, before we let you run, I know you have to fly here quickly, maybe a quick plug. The U.S. Chamber has great resources on its website. And by the way, we have great resources on our website, and some of them we've stolen from you. Thank you for that. I know you have some real nice guidance on your site related to employers and how they, the course of action that they may take related to protecting the workplace from C-19 and also for employees. So if there's a plug you want to give for your website and some additional resources, now's a great time, and then we'll let you move on with your day.
Okay, well, thank you. Well, we've really been working hard, as I know everyone has, to try to put out information and be helpful and collect questions. We do have a number of guides on our website and would encourage you all to go there and start, of course, with the Waco Chamber first, and appreciate the partnership and look forward to meeting you again in person sometime soon.
Look forward to it, Katie.
Able to
Thank
shake
you so much
hands.
for your time. Take care.
Okay.
All right.
Thank
Bye-bye.
you. Bye.
Bye. Okay, folks, let me take a moment and introduce our next speaker from the U.S. Chamber of Commerce. And I would also remind you, and I apologize, I forgot to remind you a few minutes ago that we are taking questions, so please feel free to share questions. Our next speaker is Matt Webb. Matt is the Senior Vice President for Legal Reform Policy at the U.S. Chamber's Institute for Legal Reform. Matt oversees development and advocacy of the Institute's position and policies on key federal legal reform issues. He holds a BA degree in political science from the University of Colorado. And when he's not working copious hours at the U.S. Chamber of Commerce, he is a volunteer firefighter and a paramedic in Northern Virginia. Matt, the floor is yours, and thank you for being with us.
Great. Thanks, Matt. Thanks for having me. So, saw a number of questions pop up on the screen when Katie was talking about things related to liability. So I'll try to touch on as many of these as I can as I kind of give you a quick rundown. But one of our biggest concerns about getting the business community back to work and opening the country back up are the liability issues. And there are basically, from our research, there are multiple plaintiffs' attorneys firms that are basically swarming at this point, starting to do their ads for COVID-related lawsuits. A number of suits have already been filed against multiple different types of industries for multiple types of claims, ranging from negligence to exposures to what have you, and securities litigation, for example. So there are four main areas that we're looking at that Congress really needs to step in and provide a number of protections for. The four categories are exposure-related liability claims, securities litigation claims, medical liability issues, as well as looking at some of the products liability related issues for certain products that are not covered under pre-existing liability protections that Congress has previously enacted. So taking them in order, what we're concerned about in the exposure space are companies that open their doors or already have their doors open for both their workers as well as customers coming in, and then they're faced with a claim from someone who either has contracted or is concerned that they may have contracted COVID-19 from their exposure in from that workplace or that business. We are pushing for Congress to enact liability protections to basically say that if you are not grossly negligent as a business and you're following appropriate governmental guidelines, regulations, recommendations, what have you, then you shouldn't have any liability as a result of that. And obviously, if you're grossly negligent or engage in some sort of intentional misconduct or something like that, or deliberately ignoring guidance or what have you, you wouldn't necessarily have the protections that businesses that are actually following the guidelines are that would necessarily have. We're also concerned in the medical liability space for healthcare providers as well as healthcare facilities. Because of the influx of patients they're dealing with related to COVID-19. Again, making sure that they have appropriate protections in place, that if they aren't grossly negligent or worse, then they would not necessarily have liability under these circumstances. In the securities litigation context, we're seeing multiple lawsuits that have been filed against companies for not making appropriate disclosures related to COVID-19. Our position on that is that right now is not the time to be engaging in securities litigation and basically paying one group of investors and taking the money from one group of investors and paying another group of investors. So we're pushing for basically securities litigation related to COVID-19 to be stayed or delayed until after the public health emergency has been taken care of, and then also a few other reforms in that space as well. And then finally, in the products liability space, you have a federal statute called the PrEP Act that deals with a number of basically certified countermeasures or health countermeasures that the Secretary of Health and Human Services puts forth as being something that you need to deal with for certain pandemic responses. So in the context of COVID-19, things like respirators or N95 masks are covered by that. We actually had a big legislative fight on the earlier versions of the CARES Act to make sure that respirators were fully covered because prior to that, they were not. But then it covers things like vaccines once there is one available, other sorts of medical treatments, etc. The problem is that the PrEP Act doesn't cover things like hand sanitizers, cleaning equipment, or cleaning solutions that are recommended or suggested for use as part of this. So we're pushing for those things to be included into the PrEP Act and provide liability protections for those who are making those products as well as using those products. So those are the four major categories that we're looking at right now. The trial bar, I mean, they already have a number of online ads trying to seek out plaintiffs. The television ads are starting at this point as well that we've seen. And really our basic position is that now basically suing everybody as a result of this is not going to get anybody healthy. It's not going to open up the country, and it's not going to get people back to work. And we need to have appropriate, rational guardrails put in place that basically says, if you engage in very bad conduct, okay, yes, you should be held responsible for that. But if you're trying to do the right thing and you're following the appropriate guidelines, what have you, you shouldn't be bankrupted by a bunch of lawsuits as a result of this, because you're already dealing with enough economic uncertainty because of the various shutdowns that have occurred. So with that, I'll be happy to take any questions that you may have. So.
Yeah, thank you for that overview. So a minute ago, you mentioned reopening the economy. Can you talk to us a little bit about that? I know there's a national dialogue unfolding, the president, the administration, U.S. Chambers in the middle of that conversation. Can you share with the folks who are participating today where we are in terms of gradually reopening the economy?
Well, I mean, the guidelines that the White House has put forward, it's not, and they are inconsistent with the way we've been looking at it institutionally at the U.S. Chamber, is that it really is a phased reopening, and it is largely dependent on the availability and accessibility of wide-scale testing for COVID-19. And it's also a staged reopening, and from the standpoint that if you are having cases of COVID go down in your community, then more restrictions can be lifted and more things can be opened. I think it's really a community by community, state by state sort of discussion at this point. The White House has made clear that they are looking at this from basically looking at the states to take the lead on it within the context of the guidelines that they've put forward. But I think at a certain level, it comes down to having testing available and then working to make sure that the healthcare capacity is there. Should there be an increase in the number of folks that are exhibiting symptoms or have COVID in a community. So, I mean, you could go basically from phase 1 to phase 2, back to phase 1, and which obviously no one wants to backslide and have to impose more restrictions again, because there's been a series of outbreaks or what have you in a particular community. So it's going to be challenging. And I think it's going to be something that it's going to take a lot of holding hands and working together to make it work. But I think that there is a lot of thinking going on about this at the national level, as well as the state and local levels to make this happen. And the business community is going to be integral in making things kind of move forward.
Yeah, so just a reminder to everyone, you can submit questions on the Q&A, and this would be a good time to do that. Matt, I was wondering, as we're going through this, we're learning lessons all the time. and especially in the likelihood, which it continues to be talked about, a second wave coming. Are there things that we're going to implement, lessons that are being learned now that we can use to make better decisions going forward here, policy-wise or even in our individual businesses?
My short answer is I hope so. Lessons are being learned because this is a unprecedented situation that we're all having to deal with at this point. As Katie mentioned earlier in her presentation, that this is an area where the science related to the disease, it's a work in progress. They're learning as they go along. And I think at the end of the day, what's going to have to happen is that everyone's going to have to be flexible. I think that there's going to be a need for clear guidance from the federal policymakers dealing with this, as well as the state and local policymakers dealing with it. Because I think one of the biggest challenges, at least for my end on the liability side, is that when you have conflicting sort of guidelines from one's, say, for example, from the Centers for Disease Control versus what your state health department or your state governor is saying, that really is a challenge for a business that's trying to do the right thing. When you have potentially conflicting sorts of instructions on what you should do, shouldn't do, etc. And as a result, there needs to be, I think, a lot more coordination between the various levels of government and what sort of guidelines they're putting forward in order for folks to actually have a level of comfort that they're doing the right thing and that they are able to reopen without having a deluge of lawsuits come in their way. So, because the worst thing that you can have happen as a business when you reopen is that, let's say, for example, you're following CDC guidelines and then your state health department says something totally different. You're trying to do the right thing. But obviously the trial lawyers don't necessarily care about that. They're just looking to get their payday. And part of what we're trying to accomplish with the advocacy that we're doing on Capitol Hill right now is making clear that if you're, in essence, making a good faith effort to try to comply with things and the guidelines change day by day, you as a business should not be the ones to bear the liability or the brunt of the liability for that, because that's not your fault. So.
So a quick follow-up to that before Matt asks his question. Workman's comp, have you, I know those are really more state, the workman's comp laws are more statewide, but do you see that coming into play where we would bring our workman's comp to?
Yeah, very much so.
Someone who became ill on the job and they could prove it was on the job that they caught the virus?
No, I think that workers' comp is definitely going to be an area and hotbed of litigation in this area, because there are some states that are contemplating putting in presumptions that say that you were a worker for a quote unquote essential industry and you contract COVID-19. I mean, they're talking about putting in place a presumption in their state workers' comp law that you got it at work and workers' comp would cover it. And obviously everything that goes to you as an employer as a result of that. And then the plaintiff's bar is looking at ways to actually get around the workers' comp system by filing wrongful death claims in those states that allow them for workers that may have died. So there's already been at least one lawsuit that I know that's been filed against Walmart, for example, in a particular state where a worker had COVID and unfortunately passed away. But the family is now bringing a wrongful death suit against the store. And again, it's the plaintiff's bar is creative, and they will look for every sort of avenue they possibly can. And that's just one other example of where they're going to do that.
Matt, we have a question regarding testing and liability. And the question is, regarding liability, do you recommend testing of employees using the instant test as being made more readily accessible?
Well, I think My recommendation is that the best thing to do would be to follow whatever guidelines that your state health department, your local health departments, and then whatever CDC says should or should not be done. I think you're going to have more liability protection if you're following whatever they're telling you to do versus going out solo thinking that, okay, this is the right thing or not the right thing. And in addition, I would also strongly recommend that you talk to your legal counsel about that, because there are a lot of, as Katie alluded to in her presentation, a lot of potential liability pitfalls on what you do as an employer with testing and not testing, and who you test and how you do it, and how and what you use that information for. That whether or not it's the instant test versus another one that takes more time, the issues are still largely the same in the employment space. So my strong recommendation is, again, follow whatever the guidelines are that come out from the appropriate government officials, as well as talking to your independent counsel that can help kind of guide your individual facts and circumstances the best way.
Thank you, Matt. Rick, do you have any more questions for Matt?
I don't believe we do.
Okay. Well, Matt, thank you very much for taking time to be with us today. We really appreciate your insight, and we appreciate the great relationship that we have with the U.S. Chamber of Commerce.
We very much appreciate you having me with you today, and happy to talk with you further when you have more questions. So.
We may reach out to you, Matt. Thank you so much.
Okay, take care. Bye-bye.
Stay safe. Have a good day.
Bye-bye.
Okay, folks, we also are fortunate today to have a couple of individuals from right here in our own backyard to join us to talk to us about what precautions and steps and measures that they're taking in their workplace. So let me introduce our next two speakers. We have Kyle Citrano. Kyle is the managing partner of George's Restaurants. And Kyle has been very active in a lot of conversations that we have had, industry-specific conversations we've been having over the past 3 or 4 weeks. And Kyle, we really appreciate your leadership. And we also have Ron Ordner. And Ron is Health, Safety, and Environmental Manager at Mars Wrigley. And gentlemen, I'm going to ask Ron to start. And I think making this conversational would be wonderful. So Kyle, don't be shy. Jump in at any point. And folks, I would remind you that we have an opportunity to ask questions, and please feel free to do so. Ron, Kyle?
Good afternoon. Thank you for inviting me to join this webinar. Just want to take a few minutes to kind of share some of the things that we've been doing with our factory here in Waco. We started out probably, 21 days ago, started adding layers of protection, and just about every week since then, we continue to add layers of protection for our associates that are working in our factory, as well as all of our visitors and contractors that we have on site. Some of the things we've enacted, or some of the many things that have been going on in the community and other businesses. We increased our cleaning schedules around high-touch areas. We encourage social distancing in areas where we have people working in close contact. Where we couldn't facilitate social distancing, we put up screens and have physical barriers in between the individuals that may be working in close proximity. We've set up a drive-through temp check station in our parking lot, so every associate, contractor, transport driver, etc., that comes onto the property gets temperature checked using a no-contact infrared thermometer. Most recently, we're continuing to expand on that. We sourced a automatic infrared camera that we're going to be posting at the front door. As you walk into our facility, everybody will automatically get scanned for temp check. Being in the food industry, it's important that we keep sick people out. I think the data that's out there says that temp checks are about 50% effective, but you can touch just one layer. As you build onto those layers, you increase the chances of keeping sick people out of the facility.
Ron, thank you. Kyle, what are you doing in your shop?
Well, I think a lot of it for us started before they shut restaurants down. We started making some just general changes to to make things a little easier for our guests and stuff they maybe not need to worry so much about when it started to, it started off with just taking off ketchup bottles and sweetener packets and stuff off of their tables, things that, easily are contacted by multiple people. And so we wanted to eliminate those things and make them be less of an issue for people. So when it came to those things, that they were on an as needed basis, we would bring them as they need them. Just one less thing that they need to worry about. Since we've been shut down though, lots more precautions, lots more things have had to change, especially our business model has had to change with it going to delivery and takeout. So for us, some of our cleaning practices have changed. I mean, I think the restaurant industry is definitely one of the most heavily scrutinized areas with the health department, getting multiple checks a year. And, a couple of things that we made changes for, we've had all of our staff in the front of house now wearing gloves, which typically was something we did just back of house. All of our employees that are meeting with customers now, so the people that are going out and taking food to their cars, or if they're going in delivery, are wearing both gloves and masks. We've changed some of our cleaning products that we're using, more heavily based on quat ammonia sanitizer based for all items that we can do. We've spoke with our chemical people that we buy our things from, and so that's been good for us to make sure that we're using, maybe it was a different product than we were using before, but something that will be a better use for what we're doing now. As far as, scrutinizing employees and when they're coming in, we're just really wanting to make sure that people are doing the right things when they're not around. Making sure that they're following social distancing orders, making sure that they're, sheltering in place when they can. And a lot of that's just by having conversations with them as they come in. And then we have been taking advantage of using a thermometer check, we've been using a forehead scanner at the time, but we have since ordered a non-contact thermal temperature to make sure that we have that available. Like Ron said, just having that extra layer of security, I think, is really important for both our staff, for us as the employer, and then once they allow our restaurants to open back up, for the customer, for sure. And I think a lot of it is just, the general, if they're not wearing gloves, or when they have to take gloves off, making sure they take that time to wash hands, to use hand sanitizer when it's available. That's one of the biggest supply chain issues that we're seeing, is still hand sanitizer. It's not any different as it is for the customers to get at H-E-B as it is for us. It's still difficult to find those things. So you try to make do with what you can, and really more enforce the hand washing and using the gloves, and just relying on both, for us, the Texas Restaurant Association, and guidelines that we're getting from them on best practices, and what they're asking both the federal government and the local governments for when we are able to reopen, as to what we feel are best practices that we've already been doing, and to continue to do, so that when we open up, we're able to do it in a safe and efficient way. And relying on our partners, whether it's, my food provider, Benny Keith, whether it's AutoChlor, who does my dishwashing and some of my solutions and cleaning products. Different people out there that we rely on every day are going to get more information that are going to help us. So I just think it's important that we keep those communication channels open, and not be afraid to ask for help. This is a new frontier for all of us. I think all of us want to get our businesses open. If you haven't been open, we want to do that, but it's not going to all come back at once. Our main priority is going to be safety, and making sure that we're taking care of our employees, and then taking care of our customers, because we want them to feel safe to come out and be back in restaurants.
Great, thanks. Yeah, and for participants, we've got time to take a few questions if you want to submit something. I have a question for both you guys, just as someone who runs a business as well, thinking about the potential inevitability of someone getting sick who's on our team. Do you guys have a process in place where or policies in place to know how to handle that when it happens? How you check the contacts of that person and what crew they worked with, but what processes have you guys put in place that you would recommend? Ron, I'll let you go first.
Okay. Yeah, I think we kind of benefit from being more of a global business. We have we we hired a medical director about 3 years ago who actually has a specialty in epidemiology, who started putting our COVID response plan together late last year. And as part of that plan, there is a protocol to establish who is the person one and who's person two and who's person three. And we have protocols set in place depending on whether you're that person number one that was actually tested positive, or someone like a person number two that came in close contact. If you're that person number two, you would automatically be quarantined for 14 days following the positive test result of person number one. If you're that person number three, you would be allowed to come to work, just monitor conditions. And we have an on-site occupational health nurse that keeps in close contact with everybody that might be impacted. We're lucky so far we haven't had anybody that's been that person number one, or we've had a few person number twos out that come in contact with people out in the community, but the factory itself has not been impacted.
Yeah, and I would say for us, I mean, not a formal policy by any means, but more or less just that conversation from when the time they walk in the building. We've been real upfront. We had a meeting with our staff and, communication that's gone out to them to make sure that they knew going forward, if they were still working and they weren't furloughed, that whenever they were coming in, if they've had any contact, if they've had any positive tests or anybody they were even concerned about, to be able to communicate that with us. So we have had a few people that had reached out to us that when they'd come into work and say, hey, I've got a friend of a friend or somebody that I might have come in contact with, that, not a direct contact. And so we've just told them in that time being to stay at home, not to come into work until they've got a confirmed test or an idea of what's happened. And thankfully, like Ron said, we haven't had any issues. People have been very forthcoming, and I think just keeping that extra layer of protection of testing people as they come in just keeps a sense of everything's going to be okay, and as long as we're doing that. But you just don't know. You got to continue to have that conversation with people because and people could be sick and we don't even know it because of the non-symptomatic stuff. So I think for us it's just right now keeping that conversation. And making sure that when we bring our staff back and we can get back open to continue to have training and meetings onto those situations, because it's going to be very important that they're very aware of their surroundings and the people that are around them.
Well, Ron and Kyle, thank you both very much for taking time to be with us today. We really appreciate it. Appreciate all you're doing for the community. Rick, I'm going to turn it back over to you and let you wrap it up and let folks know about tomorrow and those sorts of things. Folks, thank you so much for being with us. Rick Tulls.
Yep. Hey, Ron and Kyle, thank you so much. Thanks for what y'all do for the community. I love eating both your products for whatever that's worth. So, hey, tomorrow we've got another great opportunity. We have our Texas Workforce Commissioner, Julian Alvarez, is going to do a similar call to this. Webinar with us at 11 a.m. So that'll be tomorrow at 11 a.m. So please register for that. We're going to get some I know there's several programs that they're administering that several of us are probably tapped into, and hopefully there'll be some just other great data about what's going on and some good information that'll help us all run our businesses more efficiently. Because you think about this in the big picture, we want to, as a community, and especially as a chamber, as in serving our membership businesses, we want to keep the hole from getting any deeper than it has to get, right? So if we can do that through the spread of information, programs, getting dollars into our community through different stimulus programs or from the state as well, we're going to do that. But then I want to promise you, we're also going to go on the offensive. We're going to go out there and try to rebuild whatever we've lost and go way beyond that and make Waco a great place for businesses to come to. So just be aware that I know we're all playing defense right now, but the time for offense is coming, and your chamber is getting ready for that. So thanks again to First National Bank of Central Texas for sponsoring this time, and Spectrum Reach as a gold sponsor as well. We thank you, and we will hopefully see you guys tomorrow. Thanks for coming out.